So, as a layman who's listening to this podcast, they know that, okay, when there's a heart attack, there is a block, they go in, they put a stent. And then similarly, now awareness has been increased that there could be a heart attack of the brain.
Correct.
Where there could be a blood clot, decreasing the blood supply, and then, within minutes or within seconds, they need to go and then remove the clot. Can explain a situation similar to that? Can we say it is heart attack of the legs?
Yes. In fact, in US, when we were there, we coined the word leg attack.
Leg attack?
Yes.
What is leg attack?
So leg attack is sudden unexplained pain in the legs. Go to the nearest vascular doctor. In fact, we used to have a 1-800 number with a big billboard saying the same thing. So basically what we're trying to tell you is, see, one small difference is when the vessel to the heart gets blocked, it's a very big emergency because heart may stop. Now, if the vessel to your legs gets blocked, nothing really stops immediately, but your leg has a chance of getting cut off or jeopardized eventually over the next 8, 10, 14 hours.
I don't know, educate that a little more. So you're saying that what happens when there is a decreased blood supply to the legs?
Decreased blood supply to the legs is compromised. It is the process is not as fast as the heart attack.
Correct.
It's a little slower. Because it's a little slower, a lot of people ignore it. Okay, leg pain.
But what happens if they ignore the color of the leg changes?
Color
right?
of the leg changes. Legs may swell up. Or legs may become very black, color changes, they may have excruciating pain, severe pain, and eventually you may lose a limb also.
They can lead to amputation.
Leads to amputation. And for example, when we were in US, an average amputee costs $95,000 to the US tax economy.
Wow.
Now, this is in a structured society where you're measuring everything. In India, can you imagine? An average amputee, somebody else has stopped his work to take care of this gentleman. Then every time you have to go out, there's so many more things that you have to spend or whatever take care of. So it's a huge burden on the society.
So not only on the patient, the caregiver.
In fact, I know of caregivers, they have themselves stopped going to their jobs to take care of the amputee because who else will take care, right? We are a very loving society, very emotional society. We'll never, usually we try not to put our parent in the hands of some outsider.
Correct.
And then we go off to our work, right? So we are, because of our emotions or because of our nature, a lot of people actually have seen that, thousands of patients actually, where, this gentleman anyway went through a bad phase and has lost his limb or something, but his family member also is now virtually with him or her, right? So that's all the challenges that we have with vascular. That's what
So let's say the patient has leg amputation. What is the most common predisposing factor that he must have had in your practice?
In my practice, it is badly controlled diabetes with arterial problems. Yeah, so diabetes always plays a role in this.
Can you educate how diabetes causes a leg attack?
Oh, diabetes is very commonly causes leg attack. So diabetes, primarily the disease itself causes the vessels to narrow. It is a very high on the risk factors. Actually, it is equal to smoking if you ask me. Smoking, hypertension and diabetes are equal in the risk ability to produce arterial blocks, first of all.
So diabetes can cause blood clot in the arteries. The blood vessels.
Vessels to narrow and get clotted. Along with that, the high sugar levels in the body predispose you to get early infections. So when the blockage happens, that area further to that gets more infected. Along with that, when you give antibiotics or something to cure it, the sugar levels actually fight against that, right? And with the body's stress response, more sugar is produced, right? So all this creates a very, very, like a storm, like a perfect storm, like everything's working against you, right? High sugar level is causing blockages, blockage causing infections again getting worsened by sugar level, and more infections producing more sugar levels. So it's like everything is going down the drain, like that in a spiral. And from that point, at the very minimum, you require an ICU admission and in a prolonged stay in the ICU. At the maximum, you may lose a limb or even something more fatal. So I think, instead of going that far, early detection, going to the doctors early, finding early about this, taking care about it early is very, very important.
For a diabetic patient, we recommend to check their eyes once a year. They also recommend to check their foot once a year, right? Can I educate that?
So foot care for diabetes is most important. So what does a check involve? So check involves a close examination to look for any cracks, fissures and all that. So physical examination. Along with that, good advice, which is basically wearing some form of footwear, even at home if possible.
And the reason is that because they will not be able to sense the pain or the heart?
Because one, your nerves start dying and you don't sense things very well.
Hmm.
Two is the same story. Lot of them have compromised blood supply also. So it's a nervous thing as well as a vessels thing. When you have compromised blood supply, your defense cells are not coming in a rapid way to the injury to heal that. Right? That's basically the bottom of it. So that's very important. So maintaining a proper foot care is very important. So that's a very important part of the yearly and monthly or physical examination that we do for diabetics. Always examine the feet.